I'm very excited to be here again. As I said before, thank you all so much for taking the time to join us on our very last information session for the year 2023. Woohoo! We have had an amazing time sharing so much information about our new program, and this session is going to be one of our specialties as well. Because we not only have my wonderful self, we have Dr. Waxman, Dr. Zavala, and some of our amazing faculty members here with us today. And so before we get started, I'm going to give everyone the chance to do some introductions. So we're going to go pop style, and we're going to start off with Dr. Waxman.
Hi, everyone. I am Dr. KT Waxman. I am a professor at UCSF and the director of the DNP program, which includes both the postmasters and the post-bachelor's tracks. So I'm excited tonight to give you an overview of not only the Doctor of Nursing Practice degree, but the different options and tracks that we have within the program. So Mimi, do you want to pull up the slides?
Yes, I'm also going to give Dr. Zavala a chance to.
Oh, sure. Sorry about that. Go ahead, Dr. Zavala.
Thank you, Dr. Waxman. Like Mimi mentioned, Dr. Waxman mentioned, it's a thrill to have you here. Thanks for making this time of the day. I know that a lot of you are very busy, but I also know that you're very interested in our program. With that being said, Dr. Waxman is going to go over the details related to the program. Then our great specialty coordinators will provide detailed information about their particular specialty. And at the end, I will provide some additional information related to the admissions and application process, right? What are some of the things that you need? When do you need them? You know, how do you ask for help and so forth? So with that being said, Mimi, or actually Dr. Waxman, back to you.
Okay, so we are going to get started with our BSN to DNP presentation. And first of all, it is important that you have a BSN for the program to enter in the program. I see somebody's writing on the slide. Okay, we're just going to go with this. So I'm going to talk to you a little bit about the difference between the PhD and the DNP. So for those of you who are interested in research, who want to do some significant research, we would guide you in applying for a PhD. The DNP really translates evidence-based practice into current clinical practice and policy to improve care and patient outcomes. The DNP generates internal evidence through quality improvement outcomes and management of evidence-based practice projects. And so we really take the work that has been done by the PhD, our PhD colleagues, and then we translate that into practice and mentor others in evidence-based practice and the creation of systems to sustain it. The PhD are our colleagues who generate rigorous research using external evidence, including translational research to inform practice and policy. They provide an extension of the science and generate evidence-based theories. So as you can see in the middle of this Venn diagram, the goal is improved patient population or policy outcomes. I just want to remind folks, if they aren't on mute, to please mute. Thank you. All right, next slide. So we're really all about evidence-based practice in the DNP program. So what is the BSN to DNP? So as I said, this is a practice-focused degree. It's an academic degree, and it prepares experts in evidence-based practice, quality improvement, and leadership. We have a leadership thread throughout the entire program to prepare clinicians, nurse practitioners, APRNs, nurse leaders to lead patients, clinics, populations, units, all along the continuum. We blend clinical leadership, the economic and organizational skills in the direct and indirect practice to positively impact patient or population outcomes. We prepare students for advanced nursing practice, and leadership opportunities in a variety of settings. The DNP is endorsed by professional organizations such as the CRNA, that's the Certified Registered Nurse Anesthetist. They have determined that the doctor of nursing practice is required to practice as a CRNA. The CNS, the Clinical Nurse Specialist, their organization has determined that a DNP will be required by the year 2030, and the nurse practitioners are promoting 2025. Next slide. So why pursue this BSN to DNP? Well, there's really a demand right now for a higher educated workforce, for highly skilled and specialized nursing professionals. As you know, there's a nursing shortage. There's a healthcare shortage. The way we work needs to be changed. Our models of care need to be changed because we have an increased demand, but we have a low supply. And so at UCSF, we really want to take those who have a BSN and prepare them to be advanced practice registered nurses, ending with a Doctor of Nursing Practice degree. So, oh, I thought somebody had a question. Sorry about that. We want to equip the student with the knowledge, skills, and expertise that's needed to navigate the complexities of modern healthcare. Right now, as you know, is a very chaotic environment. We're recovering from the pandemic, and there are a lot of complex things going on in healthcare, and we need innovation, we need leaders, we need new models of care, and that's what we prepare you all to do. We need leaders to lead healthcare teams, whether they're clinicians or not, and ultimately interprofessional teams. We need leaders and DNPs that influence healthcare policy. There are a lot of policy issues right now that we as nurse leaders need to be at the table contributing to, talking to our legislators and informing our legislators of what the needs are in healthcare. And then unique specialties and curriculum that we have tailored to ensure student success. Next. So the roadmap is this. You have a Bachelor's of Science in Nursing. Come into our program, we have a cohort model. So when you start in summer of 24, hopefully, you will come in with the same group of people that you graduate with. That is the goal. You get to know one another. It's a community, and we stay within that cohort for the whole 12 quarters. We admit in the summer, and that'll be summer of 24. Applications are in progress right now. We have 12 continuous quarters, and this includes summer. We're a year-round program. It's a hybrid program where you will be doing a lot of work online. You will have synchronous Zoom sessions, and you will also be coming to campus in person. There will be up to 760 clinical hours per specialty. Some specialties may have more. And then we have 240 hours of practicum at the end of the program. So you see the 760 and the 240 add up to 1,000. The AACN, which is the American Association of Colleges of Nursing, requires anyone post-baccalaureate to obtain 1,000 hours of clinical and practicum during the DNP program. And the specialty tracks gain you at least 760 hours. So we retain the 240 for your evidence-based quality improvement project at the end that I will talk about. And it ends with what we call the EBQI project. Next slide. So this project is the culmination. You're going to go through your clinical series to gain your to be prepared as an advanced practice nurse, and we'll talk about that in each of the specialty coordinators. And then after that, and during the last part of that time, you will start thinking about your project. You're thinking about it from day one, actually, but you're going to implement it and evaluate it in the last several quarters of the program. And this is a scholarly body of work where you actually are translating research that we talked about earlier and evidence into practice. So there's a lot of lit reviews, there's a lot of research, if you will, and looking at what's out there in terms of this perhaps dilemma or conundrum that you want to solve, this process that you want to improve, or this quality improvement project that you want to undertake. And this focuses on practice improvement or quality improvement. It could even be compliance. If you see that there's a compliance issue, this could be a DNP project as well. It should be scaled to be accomplished in 4 academic quarters. So the last 4 or 5, we're working on this project. And you'll need to have site support. We have what we call a site liaison. This is like a preceptor, a mentor, but this is a site support person that actually has buy-in, that encourages you to do your project, that is on your team as we move forward with your committee. That site liaison is going to be important. And you're going to demonstrate the implementation at the system or population level, and then evaluate the outcome. Did you make a difference? If what you thought needed to be done, did you make a difference? And our link here, and these slides are available for you, links to some of the current and past doctoral projects that have been done, and those are on our website. So you're welcome to take a look at those. Here's an example of some of those. We've had students who've done a behavior change through self-empowerment after a group diabetes education program, assessing HIV, patient satisfaction, and medication adherence through telemedicine. This is a hot topic. Structured medication reconciliation of older adults in the ED, implementing measurement-based care in a VA tobacco recovery clinic, improving handoff communication in an inpatient psychiatric setting, trauma-informed care, which is another very popular topic in training in a homeless shelter, and nurse leaders perceive knowledge and confidence managing disasters in an acute care setting. So you can see that we have very focused projects, but they're also large scale. Next slide. And so here are our BSN to DNP program specialties. And then we're going to move into a little bit more detail on each. So we have the nurse-midwifery, a nurse midwife. We have a clinical nurse specialist, a CNS, in adult-gero, oncology or critical care trauma, neonatal CNS. We also, I'm going to move to the NP, and then I'm going to go back to policy. We have the nurse practitioner. So we have a family NP, adult-gero acute care NP, adult-gero primary care NP, adult-gero primary care NP in occupational environmental health, neonatal NP, acute care pediatric NP, pediatric NP in primary care, and psych mental health NP. And then lastly, we have our health policy and public health nursing, which is not an advanced practice registered nurse, but it is specialty in and of itself. And we need nurse leaders with DNPs to really think about their commitment and their contribution to health policy and public health. So we really think that's a unique program. Next year, we're going to be, after this, we're going to be launching our leadership program. Right now, we're very focused on what you see on the screen, but we will continue to grow. Next slide. And so from the Department of Physiological Nursing, the adult-gero acute care nurse practitioner. And I think that is, who's here from?
Hi, Dr. Waxman.
There you go. Lisa, there you are. I couldn't
Hi.
see you on this. I want to turn it over to Dr. Gurton, Lisa Gurton.
Thank you so much, everybody, for being here. If I can have the next slide advanced, please. My name is Dr. Lisa Gurton, and I am the specialty coordinator for the Adult-Gerontology Acute Care Nurse Practitioner program. So this program is requires 2 years of acute care nursing experience in order to be admitted into the program. And the role of the acute care nurse practitioner, adult-gero acute care nurse practitioner, is to manage patients in either a critical care setting, an acute care setting, who have acute and complex and chronic health issues that are hospitalized. So this nurse practitioner performs diagnostic testings, comes up with therapeutic plans, develops a treatment regimen for the patient. It collaborates with interdisciplinary teams within the acute care hospital setting and is dedicated to population health. So, really focusing on how to make your patient successful upon discharge from the hospital out in the community setting, getting them prepped and ready for discharge. So how do you effectively manage their chronic illness in the outpatient setting? And then ensuring that you are practicing quality and safe care within the hospital and adhering to policy and other public health concerns that come up. So a recent public health issue, as we all are acutely aware of, was COVID, and that was really stressful on our inpatient providers. So the population that this nurse practitioner manages are adults and older adults. The practice setting, as I had mentioned, is in the hospital, so either an acute or critical care, or it could be in an adult emergency department. And the credentialing bodies for this specialty are the American Nurses Credentialing Center, ANCC, or the American Association of Critical Care Nurses, AACN. And that is all I have, and I'll be around if anybody has any additional questions, and I will hand it off to Professor Block.
Thank you, Lisa. I'm a specialty coordinator for the Adult-Gerontology Clinical Nurse Specialist specialty tracks, and you may have seen that there are 2 subspecialties for critical care trauma or oncology.
Yeah.
You also don't need to choose a subspecialty. Adult gerontology clinical nurse specialist is a very broad APRN role, and these are nurses that focus on a particular population. The specialty might be defined by the practice setting. You might have a clinical nurse specialist who's in a clinic or who's with a home care agency. More frequently, you'll find them in a hospital. They may focus on a particular population, whether that's geriatrics or that's transplant patients, disease. You probably heard of clinical nurse specialists in oncology, for example, or medical subspecialties such as cardiac devices or bone marrow transplant, type of care such as rehabilitation or type of problem. The population that we serve is adult to geriatrics, so that's a very wide range, and the practice setting varies depending on the on the specialty population. A lot of the curriculum is shared with the Adult Gerontology Acute Care Nurse Practitioner program because we are in the same department and many of our graduates work in the acute care setting, but the particular clinical placements and choice of DNP project are really going to help the student gain that expertise in the particular population that accompanies their academic degree. And likewise, similar to the AG-ACNP program, we have 2 credentialing bodies. There is a national certification exam available both through the American Nurses Credentialing Center and from the American Association of Critical Care Nurses. And this specialty requires 1 year of nursing experience to apply. Thank you, Dr. Waxman.
Okay. In the Department of Family Healthcare Nursing, we have these specialties: a PNP, acute care pediatric nurse practitioner, family nurse practitioner, neonatal nurse practitioner and CNS, and a certified nurse midwife, women's health nurse practitioner, which is a CNMWHNP. So we're going to tell you a little bit about the detail of these and turn it over to Mary Ann Israel. Professor Israel.
Thank you very much for being here, everyone. I'm Mary Ann Israel. I'm the specialty coordinator for the primary care nurse practitioner program specialty. So our nurse practitioners in primary care have a variety of settings. The roles that we have are management of primary and preventative care, health promotion, anticipatory guidance, and growth and development. So those topics related to well care. Also management of common and chronic conditions and episodic illnesses. All of the specialties at UCSF focus on promotion of health equity and addressing health disparities and working with diverse and underserved populations as well. So in pediatric primary care, we have infants, children, adolescents, and young adults. As I mentioned, we're in a variety of settings. So we're in outpatient clinics, hospitals, community clinics, school-based clinics, primary care, specialty care, urgent care. And our credentialing body is called Pediatric Nursing Certification Board, or the PNCB, and the certification is in Pediatric Nurse Practitioner as a primary care nurse practitioner. You'll see my email. Please feel free to email me through the process of application. If you have any questions, you want to touch base, please do that. And then I think I'll be signing, turning over to Dr. Christensen.
Hi, yes, thank you. Thank you all for being here today. So I'm Brittany Christensen. I'm the specialty coordinator for the Acute Care Pediatric Nurse Practitioner program. So we are probably one of the newer NP specialties that are recognized nationally. So we've been recognized since 2005 due to the complex monitoring that we do with pediatric patients. So we have the same pediatric population of infants, children, adolescents, and young adults, but we take care of children on the other end of the illness spectrum with complex, acute, critical, and chronic health conditions. So that's the phrase that you have in bold print on the slide really defines the types of patients that we take care of. So that could be through diagnostic and therapeutic interventions. It involves complex monitoring, ongoing management of acute and critical episodic illness, or exacerbations of chronic illnesses, and it also includes palliative and end-of-life care. So our program trains ACPNPs as a generalist. We don't train in a specific specialty, but we do have clinical rotations that we match towards students' interests as much as possible if they do have an interest in a particular field like oncology, cardiology, things like that. So upon graduation, practice settings for ACPNPs include inpatient and hospital-based and outpatient specialties, also pediatric emergency departments and pediatric intensive care units. Some ACPNPs work in home care if there's a complex monitoring patient that needs home care, and then subspecialty areas continue to emerge within our specialty as well. So we share certification with the PNCB. It's a separate test. This test is designated as pediatric nurse practitioner in acute care. So there's a separate test between the two acute versus primary care specialties. And then I'm not sure who is my colleague that I'll be passing on to, but my email's on the slide as well if anyone has questions. Thank you.
I think it's me. Hi, nice to see everybody. I'm Lisa Mahali. I'm a family nurse practitioner and one of the co-coordinators of the Family Nurse Practitioner program. So I'm going to try to be brief because I know I hope people have lots of questions. Family nurse practitioners are trained through the entire lifespan to manage both chronic conditions and complex healthcare. FNPs tend to do a lot of reproductive health. We have a focus in our training program on health equity and on training folks who are interested in working in historically underserved locations and with historically underserved populations. The clinical rotations tend to be almost entirely in outpatient settings and ambulatory care. There is starting to be more FNPs in hospital settings, and we can talk about that with anybody who's interested, but primarily we train and then work in community settings, school-based health. Mostly our training is focused on primary care, and there are some opportunities to do specialty care if people have particular interests. FNPs work everywhere, basically, and we are credentialed by both either AANP or ANCC. You don't have to do both. It's one or the other. And as everyone else has said, happy to take questions by email or here as well. And I'll turn it over to Chrissy. Amy, sorry.
No problem. I'm Amy Renfro. I'm one of the co-specialty coordinators along with Chrissy Smith, who is here also. but she's a little under the weather, so she may chime in. So we are the co-specialty coordinators for the neonatal programs, both the neonatal nurse practitioner and CNS programs. Fairly small programs, so we do have our students combined for a lot of the coursework, but then they do branch off into distinct roles. For the neonatal nurse, well, for both specialties, we do require 2 years of neonatal intensive care nursing experience. And for the neonatal nurse practitioner program, the setting is within a hospital and a neonatal intensive care unit. We provide direct patient care and management of infants by definition up to 28 days, but then also convalescing infants who have been with us and who may remain with us longer. We do anything from convalescent care to critical care in the NICU, and the credentialing body for that is the NCC. And then on the neonatal CNS tract, also the practice setting is inpatient in the neonatal intensive care unit. These are also clinical practitioners with advanced skill sets, but are also responsible for more education, research, consult, and policy development and implementation. These practitioners are credentialed through the AACN, and our emails are up here if anyone would like to touch base with us. I didn't see anyone on the call that was for the neonatal specialty yet, but if you are, or you have colleagues who are, feel free to reach out to us. Also, as a side note, I am currently in the UCSF DNP program, if anyone has questions about that.
Thanks. Now we'll turn it over to Kim Dow to talk about the certified nurse midwife.
What?
Kim?
Hi, good evening, everyone. My name is Kim Doe. I'm specialty co-coordinator for the midwifery specialty, and I'm joined also by Amber Bell, who is on the call tonight as well. Amber and I co-lead the midwifery specialty, and just a point of clarification earlier, we have undergone a refocusing of our specialty on nurse midwifery only, so the WHNP is not currently offered as part of the specialty. The midwifery role is primarily focused on sexual and reproductive health. That's inclusive of pregnancy, but also care during the reproductive years outside of pregnancy. And for our learners, they are in settings, both outpatient ambulatory settings and in the hospital for labor and delivery. The scope of practice of nurse midwives is inclusive of home settings and birth center settings. At this point, we don't have current rotations in those particular locations. Our credentialing body is the American Midwifery Certification Board as a certified nurse midwife. And Amber and I will both be available to take questions, any questions that y'all have. Thank you.
Thank you, Kim. Department of Community Health Systems has the Adult Gero Primary Care Nurse Practitioner, the Adult Gero Primary Care Nurse Practitioner, Occupational Health, Environmental Health Subspecialty, and the Psych Mental Health Nurse Practitioner program. And the next slide is on Psych Mental Health. Is Jane here?
I'm here.
There
Hi,
you
everyone.
are.
My name is Kate Molino. I am the co-specialty coordinator for the PsycNP program, along with my colleague Jane Abanis, who will be fully stepping into that role in January. That's why her contact info is up there. The role as a psych mental health nurse practitioner is to provide a full range of primary mental health care services, which includes a biopsychosocial structural assessment and diagnosis of patients across the lifespan with both mental health disorders and co-occurring substance use disorders. As psych NPs, we provide medication management and psychotherapy as our primary treatment modalities. And of course, the foundation for both of those things is a comprehensive, holistic, trauma-informed therapeutic psychiatric assessment. We also have a heavy focus on our program on addressing health inequities and providing mental health care to diverse, underserved, and marginalized patients and communities because these experiences are highly relevant to mental health and wellness. Our population is across the lifespan, so we prepare our students to see everyone from child and youth to old age. PsycNPs practice across a very wide variety of settings, as you can see here, starting in psychiatric emergency rooms, inpatient units, outpatient clinics, school-based clinics, integrated primary care, intensive outpatient treatment, forensic mental health, and also assertive community treatment teams. And we are also credentialed by ANCC, like many of our colleagues here. So if anyone has any questions, I would be happy to answer them. Thank you.
Thank you, Kate. All right.
Hi. Yeah.
Go ahead.
I'm here. My name is Dr. Wei Seng Hong. I'm coordinator for the OEH AGPCNP. I will not go into AGPCNP portion because my colleague will explain more detailed information about the AGPCNP. Our specialty is actually dual specialty program of AGPCNP basis plus OEHN. And this is the specialty people may not know or didn't think about it, but after this information session, somebody can think about this specialty. So basically, when you graduate, you will be leading roles in preventing occupational or environmental related injury prevention, and also promotion of health for working population, and also protecting communities from environmental health hazards. And we prepare advanced level, MPs, leaders with the expertise in clinical practice, evaluation, health policy, regulations, and program development. This is a federally funded project, so you will get traineeship if you are U.S. citizen and permanent residents. And we also offer a PhD program for research training. Population, is for working population and including older adults. Practice setting is very diverse. Our graduates working in many tech companies in Silicon Valley, Apple, Google, Tesla, and currently actually Apple Global Health Occupational Leader is our PhD MP plus PhD graduate. And pharmaceutical companies like Genentech, food industries, Safeway, wineries, federal agencies like FBI, fire department, and the state government too. Also, you can work in a hospital-based occupational clinics and employ health services and other primary care settings and focusing on occupational services as well. And also you can practice in specialty areas like orthopedics, pulmonary, because many occupational diseases are, musculoskeletal or lung disease. Credentialing bodies, we already heard about it, AANP, AANC, and for occupational health specialty, we have ABAN. So if you have any questions, email me, and then we will have another specialty session in January, and then we will advertise more broadly. Thank you.
Thank you. Yunmi?
Yeah, hi, my name is Yunmi. I'm a specialty coordinator for the AGPCNP. So AGPCNPs, we do diagnosis and treat acute acute and chronic illness in people from adolescent to the end of life. And then we also prescribe medication, order tests, and provide health education to people and groups. The major part of the role is disease prevention and health promotion. We offer specialized clinical experience for students in the HIV focus. Wei Seng just described the OEH focus one, this dual program. And also we provide geriatric scholar program and also home-based primary care program. And we have especially ADPAC program is in the San Francisco VA. This is interdisciplinary program with the VA. The population is from adolescents, I said, is though we are taking care of young to middle-aged adult and older adult aged 65 years and older. And then AG-PCNPs work in also a variety of setting in mostly outpatient primary care and urgent care, such as community health clinic, school-based clinic, health maintenance organization, and any other specialty clinic. Also, we are working correctional facility and then private medical practice, as well as home-based primary care and palliative care. Also, our credential body is same ANCC, also AANP. I believe my slide is my last one. So if you are interested in AGPCNP, please contact us. Thank you.
Thank you so much. Our last specialty comes from the Department of Social and Behavioral Sciences, Health Policy and Advanced Public Health Nursing. And I believe we have either Susan
Stella.
or Stella. Yay, go ahead.
Hi, everybody. So last but not least, and if nothing so far made it you like really feel like this is the place for you, I may just have the answer you're looking for. So the Health Policy and Public Health Program, Susan and Catherine Holbrook Susan Chapman are the specialty coordinators. They couldn't be here today. I'm faculty in that program, extremely excited about that program. We really work with nurses in a range of settings. We do work a lot with nurses that are going to take leadership roles into public health departments, state or federal or county levels. We also work with people that are going to work in professional organizations or want to work. And a lot of people want to do both. They want to continue their practice, but they really want to start engaging in making changing at a system level. So if you're an emergency room nurse, you want to say why there's not better primary care for these patients, and you want to start trying to make changes at that level. So we really work with all levels of population or the students. We meet the students where they are, and we try to meet their needs in terms of the focus areas that they work. You learn a lot about program development, program evaluation, social determinants of health, and how to develop and evaluate policies that can improve or eliminate inequities. We have settings, like I said, local state health departments. We can go all the way from your local primary care or an NGO that takes care of HIV patients to the US Congress or the World Health Organization. We have opportunities to go depending again on where the interest is. We do have a lot of people demonstrating interest in being more engaged in changing the nursing workforce. And we will then pair people who are interested in engaging. How can we get more nurses? How can we educate more nurses? How can better fund nursing? And we'll then try to pair people up with that level of interest. So again, the activities that you will be performing during your practicum will be very much focused on program development, program evaluation, doing some public policy, doing some leadership experience in the area of your choice. And that's something that is really different. We'll try to find out what is really going to make you excited about being an agent of change, and we're going to try to provide that for you. And please communicate with us if you have any questions. Thank you.
Thank you so much, Stella. I'm going to turn it over to Dr. Zavala, talk about admission requirements. Joe?
Perfect. Thank you so much, Dr. Waxman, and thank you so much to all of our specialty coordinators and presenters tonight. As you could tell, we have a ton to offer, very exciting opportunities. As Dr. Waxman mentioned, you do need a BSN degree. I know that some of you are probably or might be finishing it this fall, so you could start your application, but make sure that you submit your transcript with your degree posted, right, before you press complete. Also, make sure that you choose a specialty within your application. That is on the first page of your application. We encourage applicants to do this. If you're unsure, you can contact my Dr. Lynch, and I will put her information in the chat in a second. She could walk you through some of the offerings that we have. If you have chosen a specialty, as you have seen tonight, you could definitely reach out directly to them. If you have specific questions about the application process, you could reach out to my colleague Mimi, or you could reach out to me directly. You need a goal statement. This is super important. The prompts and the details are in the application. You also need a personal statement. You need 3 or 4 letters of reference. Some of our specialties require 4. Some of them require 3. The details as to who you need to get those letters of reference are also spelled out in the application. Let's see. You need a CV or a resume, and you need a recent statistics course, college level. It could be from a community college. If you're in California, those are literally almost free, right? If you're unsure about whether that statistics course that you are taking right now or have taken in the past, reach out to me or reach out to nursing admissions, email as well. You might have some questions tonight that we're not able to answer. Don't worry. If we can't answer your specific question, we will follow up and get that answer to you. With that being said, the due date is March 1st for all applications, but we're encouraging applicants to submit and complete that application sooner than later. Some of our specialties fill up fast, and we have a rolling admissions process. That means that as soon as applications come in and are submitted, my office starts reviewing them. As soon as we ascertain that everything is in place, we hand it over to the specialty. Then they start reviewing them and eventually setting up interviews. So the process will start kicking in and speed up in January and February. So please reach out if you have questions. With that being said, I'll hand it over to my colleague, Mimi.
Thank you, Joe. All right. In this slide, as you can see, I have put some of our information. You have Dr. Waxman's email, my email, as well as Dr. Joe Zavala's email. Please reach out to us if you have any questions after this information session. I also want to highlight the one-on-one session that I do with students, applicants. It's a very important session if you are looking to talk about, your resume, you want samples for your resume, or you need some type of assistance with understanding the application process. I am here to support you, and so are all of my colleagues here. And if you want, the information of your specialty coordinator after this, you are also welcome to reach out to me as well, so I can share that with you as well. All right, before we go into question and answer segment, I want to make sure that we do a proper introduction of Dr. Lynch. She is present here. Dr. Lynch?
Get myself off mute. I want to thank all of you for being here today. This is a really exciting program that is really going to take nursing in the San Francisco Bay Area to a higher level of function and practice. And I think for any of you who are considering this commitment, this is really an important process. It's not only completing a specialty, but it's also completing foundational doctoral work for the DNP that focuses on areas such as health policy and legislation and overall nursing leadership. So this is a great opportunity. I'm obviously really biased because I've been here a while, but the coordinators who've been speaking with you are very committed for you to be able to enjoy and have excellent learning opportunities. So please give us very strong thought. This is an opportunity of a lifetime.